Hey, if you're a nursing student or a new graduate nurse and you're watching this video, I'm going to reveal something that the nursing industry won't tell you. And by the end of this video, you're gonna understand why having a high GPA will not necessarily get you hired. And it's not gonna get you hired in your dream specialty. My name is Dr. Farah Laurent. I've helped over 200 nurses get into specialty areas like the emergency department, the ICU, labor and delivery, NICU, psych, even when recruiters are telling you that you need at least a year or two experience, my clients are actually getting hired and getting same-day offers. But it has nothing to do with their GPA. That's right. Even if you have a GPA that's a 4.0, that's going to help you in the interview. But if you watch till the end, I'm going to share the 7 C's that will get you hired in your next interview. If you're frustrated, you're tired of getting rejection emails, tired of hearing recruiters tell you that you need a year or two experience, and you're just frustrated because you're putting in so many applications but not hearing anything, this video is for you. Let's get to it. Number 1, the first C is clarity. Most nursing students and most new grads are confused. Nursing school does not necessarily teach you about how to job search or really help you figure out what you really want. Yes, you have clinicals, you can have different rotations, but you might be sitting there thinking like, I don't really like any of these clinical rotations that I went to. Or you might be thinking, all my friends love a particular specialty area like the ICU or ED, but I don't really even want to work in the hospital. So step 1 is clarity. You need to be clear about what you want and where you want to be and what type of lifestyle do you want to live. What shift do you want to work? You want to work day shift, night shift? Do you want to work 12 hours, 10 hours? That is important to figure out before you start applying for jobs. So clarity is number 1. Also, in the job search process, if you're applying to too many jobs, that will not get you to the interview stage. Let's say you're applying to psych, labor and delivery, pediatrics, and NICU. The recruiter is going to be confused. They're going to think, what the heck does this nurse really want? So the more focused and clear that you get in your job search, it's going to help you land interviews, right? If you are positioning yourself for success in terms of clarity, if you want to be, for example, an emergency nurse, then you need to join the Emergency Nurses Association and put that on your resume. You need to get ACLS and all the other certifications that come along with it and put it in your resume. That's going to demonstrate to the recruiters and to the hiring managers that you are clear about what it is that you want and you're positioning yourself for success. Now, part 2 of this clarity, in your interview, you have to be very clear when you are articulating your value, talking about your past experience and your skills. And that's where that clarity will help you land your dream role. Step number 2 is communication. I don't care how high of a GPA you have, how book smart you are. If you can't communicate with clarity, be concise in your communication, and be clear, you're going to have a hard time in the interview process. The other thing, it's all in the follow-up. The way you follow up with recruiters, hiring managers, clinical instructors, past managers, that can actually set you up for success. In fact, one new grad that I actually was working with, she came to my webinar, my new graduate nurse webinar that is free, and the link is actually below to the free training. She came to my webinar, and after one piece of advice that I gave her, she made a phone call, followed up with a manager that she had a conversation with previously because I pushed her to make that phone call. She was offered a labor and delivery position before the position even came out. That's right. There was no job posting, but because she followed up in her communication, picked up the phone and called, she was offered a position that wasn't even posted. So that is the power of communication and follow-up. And I invite you to join my next free training webinar. It's down below. You can get the link and register. In fact, 2 other people that joined my webinar got so much good information that they were able to land a NICU position and PICU position just by joining this free webinar, okay? So you don't want to miss out on it. And I'm going to share so many gems in this webinar. So number 3 of the 7 C's is competence. You have to demonstrate competence in your interview. What do I mean by that? Obviously, you're in nursing, whatever role that you're applying to, trust and believe that they will ask you clinical style questions. Now, if you have trouble, you're nervous, you don't know really how to answer these questions, this is why being prepared for your interview is going to be so critical. If you can demonstrate expertise, competence in the way that you answer clinical style questions, you will get the offer. You will get the job offer. If you go to the interview and you are not prepared, you don't know how to answer clinical style questions, you will not get the position. I don't care if you have a 4.0, like I said, you have to be able to demonstrate competence. So some of the questions that they might ask you are priority style questions. You know, who would you see first? What type of patient? Typically, those are ABC type questions, airway, breathing, circulation. Or they might give you 4 or 5 patients and say, which ones would you see first, and give the rationale. Or they might give you an actual case study. The essence of this is they want you to be able to prioritize care, be able to recognize changes in condition, and be able to step in if it's an emergency and know what to do next. So that's essentially competence in the interview. Number 4 is confidence. Many of you new nurses struggle with confidence, and it's not your fault. As I mentioned, nursing school prepares you to pass the NCLEX, and we don't really focus on preparing you to be more confident and how to be bold in the interview process. But when you come to my free webinar in this training, you will learn my bold framework on how to be more confident. And that is essentially the thread of every single client that I work with. The transformation is that they're more confident. So how do you become more confident? Number 1, you have to prepare. You have to prepare for your interview so that you could be confident, okay? But it all really starts with mindset. If you deep down believe that you are prepared, that you are worthy, that you are enough, and that you deserve this position, and that you are qualified, because trust and believe, if they are interviewing you, that means that you are qualified for the position. They want to give you the position. It's just a matter of you demonstrating your confidence. And how do you do that? It's the way that you present yourself physically, the way you dress. So you have to dress to impress. You have to invest in an outfit. And your mindset has to be right. One particular client that I had, Lindsay, was a second career nurse. Her former major was an art major and also a graphic designer. And she had a difficult time in the job search interview because she was thinking, well, you know, I'm not as young as the other candidates. I'm a second career nurse. So we really had to work on her mindset and her confidence. And when that was good to go, she slayed her interview and actually got a same day offer and was selected out of 2,700 candidates in the California area. So it's all about confidence, all right? Number 5 out of the 7 C's is connection. You have to have the ability to connect with whoever is interviewing you. Whether it's a virtual style interview or an in-person interview, you have to connect with the people that you're interviewing with. Nursing is all about building relationships and people-driven business. If you can't relate and connect to people and have that ability to communicate with ease, have small talk, laugh, joke, show your personality in the interview, they're gonna think, wow, if this person can't connect, How are they going to connect with their patients, with their families, and deal with difficult situations in the hospital setting or in a healthcare setting, acute care community, whatever it is? Connection is key. How do you do that? You simply have to have a conversation with the interviewer or the group that you're speaking with. Maintain eye contact, be prepared, infuse a little bit of yourself, your personality. You know, it's okay to crack a joke and really connect, right? Because they want to make sure that they're going to hire someone who can fit on the team and someone who's fun to work with, but also, right, is competent and confident and someone they can connect with. Number 6 is charisma. I know. Some of you might be thinking, but Farah, I'm so shy, I'm introverted, I don't know how to be more charismatic. If you are too shy, too nervous in your interview, it's going to come across the wrong way. It's going to come across like you're not interested in the role, you really don't want to be there. All I'm saying is show a little bit of charisma, some enthusiasm, some excitement, smile, because that will take you a long way. Nobody wants to hang around someone who is too uptight or, doesn't smile, who is not positive, right? Especially in healthcare, we want people that are going to contribute to a healthy work environment and really be charismatic. And again, I'm not saying totally be out of character. I'm just saying give it a little bit of enthusiasm, a little spice, a little personality. And then lastly, number 7 is courage. You have to demonstrate that you have some courage in the interview. You have to have a level of advocacy, a little bit of spiciness that they can tell, hey, this person has the ability to have the audacity to step up in an emergency situation. They want someone who's not going to be a pushover. You have to have the courage to advocate. That is huge in healthcare, especially when it comes to safety and quality. That's one aspect. And then the other aspect is to have the courage to really put yourself out there. So a lot of my clients, I teach them how to optimize their LinkedIn. We sometimes also do introduction videos on LinkedIn. And that's the courage that I'm talking about. Going to networking events, putting yourself out there, and really just being courageous. And that is what will get you hired. And those are my 7 C's. That is the framework that I use, that despite having a 4.0 GPA, you have to incorporate the 7 C's in your next interview to get hired. So you don't want to miss out on my weekly webinars. Click the link below to see when the next webinar is happening. And if you are serious about landing your dream specialty role, then please watch my next videos, and I'll see you in the next one.